Hello, this DVD is designed to share the information that we have about living kidney donation with you. We hope that this will help you to make your decision about whether or not you wish to be a living donor. For the professionals involved, this situation is very different from how we usually advise patients, because we're not discussing something that will make you better. When we discuss living kidney donation, we're advising healthy people about a procedure which they do not need to have to improve their own health. Here, we can potentially only do you harm, so we want to ensure that your decision is well informed and entirely voluntary. Kidney transplantation from living donors is now an established and successful technique for the treatment of kidney disease. We think that it is the best form of treatment for the individual with severe kidney disease, and the risks to the donor are minimal.
If you decide that you wish to be considered as a donor, you will be contacted by a living donor coordinator who will perform an initial health check and establish whether there are any major issues which would exclude you from further assessment, including your compatibility with your recipient. You'll then be asked to attend the hospital for more tests and consultations to assess your health and suitability as a donor and to ensure that the risks of surgery for you are minimal. Your medical assessment is performed by a consultant nephrologist or kidney doctor. And if this is satisfactory, you will meet the transplant surgeon who will discuss the various options for surgery that are available and advise you about the risks of each procedure. You will have a number of investigations, including blood tests, heart tests and scans of your kidneys. If you are an older donor, it is likely that you will have more tests. It's not unusual to come across problems during the assessment process that could prevent you from being a donor. This may not mean that you're an unhealthy person, merely that you are not a suitable donor for a very specific reason. Equally, you may decide that you wish to withdraw from the process at any stage, and we will support you to do so, and your reasons will be kept confidential. When your assessment is complete, we can think about setting a date for surgery. We will always try to fit in as much as we can with your commitments and requirements. Since the 1st of September 2006, the Human Tissue Act 2004 for England, Wales and Northern Ireland, and the Human Tissue Scotland Act 2006 provide the legal framework that governs living donation in the UK. Once the donor and recipient have been fully assessed by the transplant team, an independent assessment will be arranged locally for both parties, and the donation must then be approved by the Human Tissue Authority, which is responsible for ensuring that donors are not put under any pressure to donate and that there is no payment or coercion involved, which is illegal in the UK. Under the Human Tissue Act, it's also possible for a living person to donate a kidney anonymously to someone whom they have never met. This is called non-directed altruistic donation. Also, a donor and recipient who are incompatible by either blood group or tissue type can be paired with another donor and recipient pair in the same situation through a national matching scheme. This is known as paired donation, and you will hear more about this later. More information about the Human Tissue Act and Human Tissue Authority is available on their website at www.hta.gov.uk.
It may be that your donor assessment is carried out at one hospital and then you're referred to another hospital, the transplant centre, for the surgery itself. In this case, your kidney specialist will refer you to the transplant surgeon in the usual way, and depending where you live, the surgeon will arrange to see you either in your assessment hospital or in the transplant centre.
Any operation has its risks. Living kidney donation is classed as major surgery, and the risk of death is approximately 3 in 10,000 operations, which is similar to any procedure for which you would need a general anaesthetic. Other complications include bleeding, infection, blood clots in the legs, and other more minor problems. These fortunately are rare and occur in less than 1% of patients, but you must be aware that they can happen. While there is no actual physical benefit from giving a kidney for the donor, many donors gain considerable satisfaction from helping a friend or loved one, and these feelings may last for a very long time. There are many benefits for recipients who receive a kidney from a living donor. We know that kidneys from living donors last longer than those from people who have died, what we call cadaveric donors. These graphs show the different outcomes from cadaveric and living donation. For a cadaveric recipient, 77% of kidneys will be working at 5 years and 58% at 10 years. With a living donor kidney, 84% are working at 5 years and 66% at 10 years. If we look at patient survival, the figures show an even bigger difference. For patients receiving a cadaveric kidney, 83% will be alive at 5 years and 61% at 10 years. For living donor recipients, 94% will be alive at 5 years and 85% at 10 years. It has also been found that kidneys last longer in individuals who've had a transplant before they need dialysis. We call this preemptive transplantation. This is difficult to arrange unless the recipient has a living donor, because the allocation of kidneys from the transplant list is unpredictable, and many patients have to wait for a long time on the list before a kidney becomes available. This is especially true of people with less common tissue types, and often applies to individuals from ethnically diverse backgrounds. A kidney from a living donor may prevent a long wait and avoids the uncertainty that many patients experience whilst they wait for a kidney to come up on the list. The benefit of a living donor transplant is that it can be planned, and so patients feel that they have some control over their lives.
It's quite possible to live a completely normal, healthy life with only one kidney. In fact, many people are born this way and never know it. We do need to do tests to make sure that both kidneys work well and that you don't have an underlying problem such as diabetes or high blood pressure, which might damage your kidneys in the future. But if both kidneys are healthy, the evidence suggests that after kidney donation, you'll still live a normal length of time without increased risk of kidney disease. In some studies, even after 20 years, there seems to be very little difference in health between kidney donors and their brothers or sisters who didn't donate. Some reports do suggest a slight increase in blood pressure following donation, but others show that this is no different from the increase in blood pressure that occurs normally as we get older. In fact, a large study from Sweden showed that kidney donors tend to live longer than the general population, probably because they're selected on the basis of good health and are very carefully screened prior to donation. Many people ask what happens if the remaining kidney is damaged, say in an accident. Well, an accident so severe as to damage one kidney would most likely damage both kidneys under the same circumstances, and there's obviously no way of predicting or preventing something like this. But there are certain medical conditions, such as kidney stones, which would put you at particular risk if you had only one kidney. We screen donors for conditions like this, and if we found that you had such a condition, we could take special precautions to protect you for the future. In general, being a kidney donor doesn't put you at greater risk of illness or accident than the rest of the population. That doesn't mean that you'll never get any other illnesses, it just means that your risk is the same as anyone else. We're also asked if it's possible to have children after donating a kidney. There's no reason why you shouldn't lead a completely normal life after donating a kidney, and for women of childbearing age this includes having children. You would of course have to tell your doctor or midwife so that your kidney function could be monitored during pregnancy.
The kidney is slightly bigger than a fist, and there are two main ways of removing it from the body. The open procedure involves a cut under the ribs on the side of the kidney to be taken out. This is quite a long scar, but it is the method that has been used for many years, and the surgeon can directly see the kidney as he works. There is also now a technique using a laparoscope, which involves a number of smaller scars. This is often referred to as keyhole surgery, and may be offered to you if you are suitable. Here, the surgeon places a small camera into the abdomen or tummy, and pictures are relayed to a TV screen whilst he works to remove the kidney with specially designed instruments. The kidney is then removed without making a large scar. Your surgeon will discuss which technique is more suitable for you and your particular situation. You may experience less pain immediately after the operation with the keyhole surgery, and this may help you to recover more quickly. However, it is possible to control the pain from either procedure with good pain relief. The long-term results of the two procedures appear to be identical. There may be a slightly higher risk of a problem with the bowels in laparoscopic operations in the very long term, but this is rare and only occurs in less than 1% of cases. During the week before the planned date of surgery, you and your recipient will need to attend the hospital for final blood tests and a pre-admission visit to ensure that everything is still safe to proceed. You will both be admitted to the hospital the day before the operation. Following surgery, you will be able to leave hospital if all goes well within 3 to 7 days. You will be given painkillers to take home with you and advice about what to do at home and when to return for follow-up appointments. Initially, these will be at the transplant centre, but can be arranged locally for you thereafter if you prefer. There is no diet or fluid restriction after the operation. You will not be allowed to drive for up to 4 weeks depending on the type of surgery that you have, and you should do no lifting for at least 6 weeks. It is important that someone can go to the supermarket if you live on your own. The length of time you will need before you return to work or resume your normal lifestyle is largely dependent upon your own recovery, the type of job you do, or the activities that you enjoy. We advise up to 3 months following the open procedure before resuming strenuous exercise. Most donors feel this is about right when we speak to them after they have donated. Sometimes donors and recipients have blood groups which don't match. In other cases, the recipient may have antibodies against the donor kidney. They are known as highly sensitized. In both of these situations in the past, we were unable to carry out the transplant, but now it is often possible to treat the recipient before surgery. Essentially, we remove some antibodies from the recipient to allow the transplant to go ahead. This is not always successful, but can usually be done. If the transplant goes ahead, the results will be at least as good and probably better than using a deceased donor kidney. An alternative in these cases is to undergo what is known as paired donation. Once you and your recipient have been fully assessed, your names are entered into a national pool with other incompatible pairs. About every 3 months, a computerized matching run is performed to match as many pairs together as possible into compatible exchanges. Surgery is then set up simultaneously with 2 pairs so that a kidney from one donor is then transported to the other recipient and vice versa. The advantage of this scheme is that the recipient does not need to have the antibody removal treatment before the transplant can go ahead, and the success of the transplant should be equal to a straightforward living donor kidney transplant. However, not every pair will be matched with another pair, so it can be more difficult to predict if and when a transplant may happen, and for you to plan ahead. It should be possible to enter the scheme and to pursue the option of donating to your own recipient at the same time. Antibody removal may not be available in every transplant centre, so you should discuss this with your own transplant team. If you are offered an exchange, you may decide to take it. If not, you could still potentially donate to your own recipient.
It's important that you discuss the donation with your family, friends and work colleagues. You will need help and support from your family and friends around the time of the operation, and it is important to plan this together in advance and for you to agree how they might be involved if they want to be. Many employers will give time off for kidney donation. For individuals who lose out financially, it is possible to apply for reimbursement for legitimate expenses, including loss of earnings. The mechanism for doing this is variable across the country, but it is an important issue and we will do our best to help you in any way that we can. There are many members of our team who are available for advice and support. You only need to ask if there is someone you wish to see. For example, a counsellor or another donor who has previously donated may be helpful for you to talk to.
We hope that this video has given you some insight into being a kidney donor, and that it will help you to ask more questions when you see the coordinators and doctors in the clinic. Donating a kidney is a major decision and it takes courage, so it's important that you have all the information you need to make the right decision. The best decision is the one that is right for you.